Hello, my name is John Lohr, and I'm with the County Resource Guide. I'm here with Dr. Bernardini, who's going to share some information that's vital to us as we all age. Doctor, what are some of the newest developments in treating issues of osteoporosis?
Osteoporosis is, for our readers, is in simple terms a loss of bone mass. As we age, and from the time we turn 21, it's a decline both for men and women. Unfortunately, the female population has a more rapid decline especially after menopause. The bone density is lost and therefore makes it much more vulnerable to traumatic injury. A simple cough, a sneeze, trying to open a stuck window can get a fracture of the spine in the elderly. And maybe the right term isn't elderly, in the osteoporotic patient.
Right.
Similarly, when you do a DEXA scan, which is the test that we use here to observe and to diagnose whether or not a patient is osteoporotic or pre-osteoporotic, they study the spine, the wrist, and the hips. Those are the three most frequent areas of injury, and those are the injuries which I technically take care of most often today in my traumatic practice. The new innovative treatment for kyphoplasty is kyphoplasty for the spine, is a small incision of the spine on the back, on the skin actually, through two sequencing video machines in the operating room. We pass a small wire into the vertebral body. The body then is lifted up with a tampon balloon, much like the arteries of the heart or the treatments for arterial closure. That space is then filled with a special bone cement that we use in knee replacements, hip replacements, and it's immediately fortified. The most amazing thing about it is that the pain is gone. Wow. There's no bracing. And the brace is the only other treatment if you choose not to have surgery. If you don't, the compressed fracture of the vertebrae will progress and become worse. In hip surgery, the osteoporotic hip, we used to make an incision maybe a foot long. Now they're done in inches because of the manufacturer's new approach to internal fixation. So I think that as the engineers and the people that we rarely talk about behind the scenes make these innovative changes, we as orthopedics are able to bring them to the public with less risk, less sizes and surgical incisions, less surgical time, and freedom from some of the complications of all those things.
It sounds incredible. And
it really is.
It's got to help people in their recovery time and their...
And in the time when they're in need.
Sure.
As we all age today, I think those are the questions of the quality of life. And I think that's one of the most important things that we do as orthopedists. We help people and their quality of living.
Thank you very much for sharing that information with our readers.